Okay, so this looks dramatic. Bead coming out of the nose, coughing, panicking. But your horse can breathe. This isn't the airway, this is choke, and this is what's really going on. Choke in horses is an obstruction of the esophagus or the food pipe. It's not the trachea. They're not suffocating, they're uncomfortable, they're distressed, but the airway is still open. The esophagus runs up here behind the trachea. When something gets stuck, usually feed, the muscles then spasm. Saliva builds up and suddenly everything looks like a crisis. You'll notice a few classic signs. Feed-tinged fluid coming out from the nostrils, coughing or gagging, stretching of the neck, lots of drooling, and anxiety or repeated attempts to swallow. It's messy, it's loud, and it's scary, but it's not the airway shutting down. The anatomy twist that confuses everyone is that horses can't vomit. The soft palate creates a kind of one-way system. So when the esophagus is blocked, saliva and food have nowhere to go except for up and out of the nostrils. Normally, a bolus of food slides freely down the esophagus into the stomach, whereas in choke, this gets stuck. The muscles clamp down, saliva begins to build up, and the horse begins to panic. This in turn then makes the spasms even worse. Here's the most important part. Stay calm. Remove all feed and keep the horse somewhere safe and quiet. And please don't be tempted to squirt something like water or oil into the mouth to try and move the bolus. This just leaves us at risk of aspiration. If the signs aren't resolving quickly or the horse appears particularly distressed, this is when you need to call the vet. When your vet arrives, the first thing we normally do is give sedation. This is going to relax the esophagus, and quite often that action alone is enough to help that bolus of food, that cloggage, move down towards the stomach. If it doesn't clear with just sedation, we then pass a stomach tube. Quite often passing the stomach tube down the esophagus is enough to gently push that blockage towards the stomach. No force, no pressure, just patience. We'll also check for the reason why it happened. It could be dental problems, it could be bolting of feed, dry pellets for example are particularly bad, perhaps dehydration, or sometimes just a horse that eats like it's a competitive sport. Most choke cases resolve particularly well, but keep an eye out for complications such as aspirational pneumonia or esophageal irritation. That's why monitoring after the choke episode is particularly important. Prevention is all about reducing risk. Good dental care, soaking feed, slowing down those greedy eaters, and preventing dehydration. Fix the reason why it happened, and you dramatically reduce the risk of it reoccurring in future. Choke looks dramatic, but with calm handling and the right steps, most horses recover quickly. And the real key is actually understanding what's happening inside. If you found this helpful, follow along for more clear, honest equine health problems, and I'll see you in the next video.